Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by advanced heart failure cardiologist, Dr. Mrinalini Krishnan. Today, we're discussing pulmonary hypertension and the importance of not delaying care. Although pulmonary hypertension, or PH, is rare, it is a serious condition where the blood vessels that carry blood from your heart to your lungs becomes hard and narrow, causing your heart to work harder to pump the blood through. So today we'll talk about risk factors, symptoms, diagnosis, and treatment for pulmonary hypertension. So thank you for joining us today. Give us a like, let us know you're watching, share this broadcast with your friends and family, and ask your questions in the comments. Dr. Krishnan, welcome, and thank you for joining us.
Thank you so much. So as you know, I'm Dr. Mrinalini Krishnan. I'm an advanced heart failure and transplant cardiologist at MedStar, and I specialize in caring for patients with pulmonary hypertension, and I see them both here at Union Memorial in Baltimore, as well as at Washington Hospital Center in DC. So I've actually been a part of the MedStar team for about 2 years now, including my heart failure training in DC. And prior to which I was actually at the University of Alabama at Birmingham, specifically training in pulmonary hypertension and heart failure. I'm also the educational chair for cardiology here at MedStar in Baltimore. So I'm very passionate about teaching, whether it's my patients, whether it's medical students or residents, junior doctors, or really whoever wants to learn. So as you know, Karen, this is my second Facebook Live. So for those of you that tuned in back in February, we spoke about COVID-19 and heart failure. And so today I'm really excited to talk about pulmonary hypertension. So thank you so much for having me.
Of course. Thank you so much for joining us. And thank you for telling our viewers about yourself. And we're glad to have you back. So let's get into some questions we have about pulmonary hypertension. Let's just start with, what is it and what causes it?
Absolutely. So pulmonary hypertension is a medical condition that affects the arteries or the blood vessels in your lungs. So pulmonary meaning a lung, and hypertension meaning high pressure. So just like patients who have hypertension or high pressure, these patients specifically have high blood pressures in their lung arteries. So the way we think about it is all the blood in our body comes back to the right side of the heart and then goes into your lungs and your lung arteries, and then into your lungs where oxygen and carbon dioxide get exchanged. And then that blood with oxygen then goes to the left side of the heart and then gets pushed out to your body again. So it's kind of like a hose. If you pinch down at a certain part of a hose, then you get back pressure behind that point. So these patients will get high pressures or pinching down in their lung arteries, which can then cause stretching or strain and even lead to the failing of the right side of the heart as a result of that.
Thank you. That makes a lot of sense. And thank you for that analogy. That helps me to, and our viewers, I'm sure, to understand what it is. So what are the symptoms that indicate someone might have pulmonary hypertension?
So pulmonary hypertension is a little bit tricky in the sense that some of the symptoms people have overlap with a lot of other medical conditions. So people might have trouble breathing, especially when they try to do certain activities, or they might even have fatigue or tiredness. So a lot of people, as they get older, kind of just chalk that up to getting older and they're not really sure, but their stamina isn't there the way that it was before, and their breathing really limits them from what they're able to do, and they're not able to do the things they were able to do before 3 months, 6 months, or a year before. When it leads to the point of having right-sided heart failure as a result of those high pressures, then people can start having swelling in their belly or in their legs and more trouble breathing. So these are typically things that we tell any of our heart failure patients to look out for.
Thank you very much. So it's really important that our viewers understand pulmonary hypertension because it can be confused with other things that are happening. So thank you for that. How is it diagnosed?
So pulmonary hypertension is something where if we suspect somebody has it, we'll typically start with a screening test, which is called an echocardiogram or an ultrasound of your heart. So we're able to take pictures of the heart and able to see if the heart is able to pump the blood out to the body. The other thing these pictures will show us is if there is a chance that there's high pressures in the right side of the heart or towards the lung arteries. And it can also show us the right side of the heart and how well that is pumping and squeezing and if that's been stretched out over time. So if we get an echocardiogram and suspect that somebody may have pulmonary hypertension, the definitive test to know if the pressures truly are high is to go in the heart and measure them. So it's called a right heart catheterization, where we'll typically go in a vein, either in your neck or in your groin with a plastic catheter. And we actually lead that up and inside your heart and measure the pressures in your heart and up into those pulmonary arteries. And that test will also give us a good idea if your heart is then able to get blood around to your body, like we were talking about earlier.
Great. That's very interesting. What are the different types of pulmonary hypertension?
So there's a lot of things that can cause pulmonary hypertension. And as a result, pulmonary hypertension has actually been broken down into 5 categories. So group 1 through group 5, pulmonary hypertension. So group 1 refers to pulmonary hypertension that is truly caused by an issue with those arteries themselves, where the arteries have gotten damaged over time with high pressures and continue to cause those pressures to keep rising. So that's group 1, or pulmonary arterial hypertension, which can sometimes be associated with things like lupus or sarcoidosis or other medical conditions that can lead to that as well. Or even HIV, for example. Group 2 pulmonary hypertension refers to high pressures in the lung arteries that's actually caused by the left side of the heart. So if you have left-sided heart failure or any valve disease in the left side of the heart, that can cause the back pressure to happen into the lungs, causing the pressures in the lungs to be high. So that's group 2 pulmonary hypertension. Group 3 pulmonary hypertension refers to any lung disease or low oxygen levels that can cause those pressures to become high. So that could be COPD, it could be asthma, it could be sleep apnea, any of those things that can then cause the pressures in the lung arteries to become high. Group 4 pulmonary hypertension, or also called CTEPH, chronic thromboembolic pulmonary hypertension, refers to if you have a blood clot in your lung arteries, and then over time that old blood clot is causing a clog. So your blood is not able to get through there and out to your body like it needs to, and that pressure builds up and causes high pressures or pulmonary hypertension, group 4. And then group 5 is a category that can be all sorts of other things that may be contributing and causing, again, with sarcoidosis, as I had mentioned earlier. So that's a tricky one because we typically will check all sorts of blood work to look for autoimmune, meaning the body working against itself type of conditions that can cause pulmonary hypertension as well.
Okay, thank you. So 5 different types. When you're diagnosed with pulmonary hypertension, would you be also told what type you have?
Absolutely, because that's going to be critical when we talk about how we treat that pulmonary hypertension as well.
Great, thank you. And I know we're going to be talking about treatment a little bit later, but in terms of who gets pulmonary hypertension, can you talk about the difference between adults and children? Can adults and children get pulmonary hypertension, or is it only found in adults?
Yeah, so that's a great question. So depending on the type of pulmonary hypertension that somebody might have, typically the types of patients that I will see will be adult patients that have pulmonary hypertension. And typically it tends to be more common in female patients. But if somebody has lung disease, that would predispose them, or if they have heart disease, that could predispose them. So those patients would be at a higher risk of developing pulmonary hypertension as well. There is a small subset of pulmonary hypertension that's also genetic or hereditary, so it can run in your family. And so that can be seen in younger patients, even in children. Or if somebody has any heart defects or lung defects that they're born with, so congenital defects, that can also cause pulmonary hypertension in childhood as well.
Thank you very much. There's a related question from our viewer, Kyle. The question is about patients with current cardiac conditions. Are they more susceptible to future pulmonary hypertension if they have a current cardiac condition?
Yeah, so that depends on what cardiac condition they have. So there's a lot of cardiac conditions, including blockages in the heart arteries, which is coronary disease, or arrhythmias such as atrial fibrillation. Things like that do not necessarily have anything to do with the pressures in the lung arteries. When I talk about heart conditions that could be related to pulmonary hypertension, I'm referring back to that group 2 pulmonary hypertension, meaning the left side of the heart causing back pressure into the lung arteries. And over time, those lung arteries have remodeling and can get thicker and stiffer and have high pressure. So this is typically left-sided heart failure, typically in patients that have heart failure where their heart is stiff and not able to relax to push the blood out and then relax between each heartbeat. Or sometimes if people have issues with the heart valves on the left side of the heart, which is the mitral valve, if it's leaking and things like that, that can cause that back pressure to go back to the lung arteries and cause the pressures to be high. So I wouldn't say all cardiac conditions, but there are certain cardiac conditions that can definitely lead to pulmonary hypertension.
Thank you very much. Can you talk a little bit more about who typically gets PH? Are there certain people who are more likely to develop that than others?
Yeah, absolutely. So there are certain medical conditions, which I alluded to earlier, that are associated with pulmonary hypertension. So there's definitely certain autoimmune diseases, as I mentioned, lupus, for example. So patients with connective tissue disorders, those are the patients that can be at higher risk for developing pulmonary hypertension.
Thank you very much. You talked earlier about when we were talking about the symptoms and how some people might think that it's another health condition, but can you talk about, does pulmonary hypertension increase the risk of developing other health conditions, or can it make an existing condition worse?
Yeah, so that's also a great question. So pulmonary hypertension is affecting your lungs. So as a result, if you have any other conditions that are affecting your lungs, then those kind of work against each other and they work against your body or multiply the effects on your body. So anybody that has any other pre-existing lung conditions, pulmonary hypertension can definitely make their breathing or their ability to do activities, et cetera, a lot worse. The other big thing that I always highlight to my patients is anybody that's on oxygen therapy, it's extremely important that patients maintain their oxygen levels at an appropriate level, typically over 90 or 92% oxygen levels. The reason being, our bodies are built so that if our body senses low oxygen, the compensation that our body does is it actually creates higher pressures in those lung arteries. So you can imagine if somebody has pulmonary hypertension, so they already have high pressures in their lung arteries, then if they have low oxygen levels, their brain tells their lung arteries to clamp down even more, which causes lower oxygen, which causes higher pressures. And then it's just this vicious cycle. So we never want to get into that situation. So we maintain those oxygen levels high enough so they never get to the point where they kind of get spiraling and have worsening of their hypoxia or low oxygen levels or their breathing.
Thank you. What about COVID-19? Does pulmonary hypertension increase your risk for COVID?
That's a great question, and it's a conversation I have with all my patients. So it's not to say necessarily that having pulmonary hypertension would put you at increased risk of developing the COVID infection. However, what I tell all my patients is they already have lung disease, which means if they were to contract COVID, that will affect their body much more severely than when they compare to somebody that does not have any lung disease or heart disease. So I encourage all my patients to be vaccinated, double vaccinated. And when the time comes for boosters, I think that's going to be a strong push to get boosters for the vaccine as well for these patients, because God forbid they develop COVID infection, they can get very sick. And unfortunately, even with some of my own patients, they can end up in the ICU, intubated, and even die.
Right. Thank you.
Mm-hmm.
So let's take a moment. We have had some additional viewers join us. Wanted to say welcome and thank you for joining us. We are talking today with advanced heart failure cardiologist, Dr. Mrinalini Krishnan, and we're talking about pulmonary hypertension. So thank you for all of your comments and questions so far. And if you have other questions for Dr. Krishnan, please ask them in the comments. We've talked about the causes, the symptoms, diagnosis, the 5 different types, who gets pulmonary hypertension, and is there an increased risk of developing other health conditions. But now I'd like to talk about treatment, which we started talking about a little bit or alluded to. The first question I have for you is, what type of doctor treats pulmonary hypertension?
Yeah, so pulmonary hypertension is not a common disease. It's a very specific, specialized disease process. And as a result, not every cardiologist or pulmonologist out there is comfortable or has the ability to treat these patients. So pulmonary hypertension is typically treated by a specialized cardiologist or a specialized pulmonologist, where they have access to the specific medications, which we'll be talking about shortly, and other kind of things up their sleeves, so to speak, in taking care of these very specialized patients.
Thank you. How is pulmonary hypertension treated? And can you talk a little bit about the medications used as well and what they do?
Absolutely. So this is a big bag of things, is how I would say it. The main thing about pulmonary hypertension is you got to figure out what's causing the pulmonary hypertension. And then as a result, we treat the thing that's causing it. So if somebody has group 2 pulmonary hypertension caused by their heart, the left side of their heart, then we manage that. If somebody has group 3 pulmonary hypertension, meaning it's caused by their lungs, then we treat their COPD, or we treat their sleep apnea, and we treat their low oxygen levels in order to lower those blood pressures in the lung arteries. For the patients that have group 4 pulmonary hypertension, they might have blood clots that are in their lung arteries. So we can even do surgeries where we actually go in and take out the clot that's sitting there in order to alleviate that pressure and bring the pressures down, or even sometimes cure their pulmonary hypertension. And then in group 5 pulmonary hypertension, we treat whatever the underlying causes can be. For group 1 pulmonary hypertension, which is pulmonary arterial hypertension, that's the one that has very specific specialized medications for this medical process. So there's several categories, 3 different categories of medications that we can use, with the logic being that we're trying to alleviate that pressure or lower the pressure in the lung arteries. So they're called vasodilators because they dilate those vessels, the vaso, in your lungs specifically. So sometimes it's actually a funny conversation I'll have with my patients, because one category are called phosphodiesterase inhibitors, or commonly what people have heard of as Viagra or Cialis. So a lot of patients say, "Doc, you're going to give me Viagra for my pulmonary hypertension?" but that's what works. So there's one category, which would be either sildenafil or tadalafil, which can help alleviate that pressure in the lung arteries. There's another category of medications, which is also oral medications, which is macitentan or bosentan, for example. And then a third category of medication can actually come as pills, as an inhaled type of medication, or even continuous infusion, either through an IV that we can put into their arm or subcutaneously through their skin. So what we typically try to do is we try to come at it a few different ways, because we've seen that in patients where we hesitate or we take longer to kind of build up the medications to treat this, we see them developing right heart failure and getting worse, unfortunately. So we try to come to treat the pulmonary arterial hypertension with one medication, typically in each of these categories.
Thank you. What happens if your pulmonary hypertension is left untreated?
Yeah, so as I was mentioning, one of the things is your oxygen levels typically tend to get lower, which will then cause your pulmonary hypertension to get worse. And then you kind of just spiral into right-sided heart failure. So anytime when you leave these pressures untreated, as I mentioned with our analogy earlier, you're pinching down on that hose. And if you continue to pinch down, there's so much back pressure that the right side of the heart just can't handle it. And people develop right-sided heart failure and can even die.
Thank you. That's why we want to educate our viewers and hope that you all share this information with your friends and family, because it is a serious condition. And while it's rare, we do want to make sure that you know what to look out for and what the risks are, and make sure that you get treated for it, and why you shouldn't delay that care. Speaking of our viewers, we have some other questions for you from them. This one's from Anna. Anna, thank you for your question. She said, I had a quad bypass 8 years ago. Is this condition pertaining to me?
So I'm guessing she's referring to a quadruple bypass surgery, which is the coronary arteries, meaning she had blockages and she had bypass surgery. So that would mean that she had coronary disease or heart blockages. And so typically that's not something that, that we see causing pulmonary hypertension. That being said, I think, the big thing to do, sorry.
It's okay.
That being said, the big thing to do is try to make sure that the left side of the heart is working properly, because if the left side of the heart doesn't relax properly, then that back pressure could cause high pressures in the lung arteries. So not necessarily directly related to having a quadruple bypass surgery, but if the heart pumping function and relaxing function is not normal, that could potentially be causing some pulmonary hypertension.
Thank you very much. I have another question from Rose. Rose asks, can scarcoidosis have to do with this? And can you, I know I'm not familiar with what scarcoidosis is, so there might be viewers that don't know either. If you could address that and then answer Rose's question.
Absolutely. So that's a really great question. So sarcoidosis is an infiltrative condition that can affect different parts of your heart, for example, but it's actually an inflammatory condition that can also affect your lungs and your lung arteries. So patients that have sarcoidosis, again, something that could also run in their families. But what happens is different parts of their body will have inflammation. And so if you have inflammation in the heart muscle itself, that can cause infiltrative disease, as I mentioned earlier, which can cause the heart muscle to not be able to work properly. If you have sarcoidosis in your lungs, then that can affect your breathing and your ability for your lungs to work properly. So sarcoidosis can also directly affect the lung arteries and can cause pulmonary hypertension. So it's kind of that caveat to the categories of types of pulmonary hypertension, as I was mentioning, because sarcoidosis could truly be a group 3 where it's affecting the lungs. It could be a group 5 where it's one of those kind of mixed bag other things that are affecting your whole body. And it can be a group 1 depending on if the vessels themselves also get affected. So that's a tricky one, and it's definitely a subset of patients that we see and that we definitely look into and make sure that they don't have pulmonary hypertension, or we treat it and treat their sarcoidosis to kind of keep it in check.
Thank you. And thank you for that question, Rose. This is a related question from Tammy. Where would you find a specialized cardiologist or pulmonary physician?
That's a great question. So
Right
you're looking at so a lot of health systems will have typically at least 1 or 2 providers that can take care of pulmonary hypertension specifically. So at MedStar, there's me, and then there's also Dr. Raymond Young, who works out of the Baltimore part of our team and takes care of pulmonary hypertension. And then down in DC, we actually have, we're trying to build up our team. So we actually have a nurse practitioner that works with us as well. And then Dr. John Scherner, who is a pulmonologist, also helps out with our pulmonary hypertension patients.
Wonderful. Thank you. Great question, Tammy. Thank you very much for that. We have some more questions rolling in from our viewers. This one is from Erica. Is pulmonary hypertension considered a lung disease, heart disease, or both?
That's a great question. It's really both. So if you have lung disease that could cause your pulmonary hypertension or your high pressures in your lungs, if you have heart disease, that could cause pulmonary hypertension. But really, when we get kind of at a purest level about it, the pulmonary hypertension is affecting the blood vessels. So it's a cardiac disease, but in the lungs. So it's a lung disease. So it's really a combination of both.
Wonderful. Thank you. Thanks, Erica, for that question. We have another question from Bonnie. She says, my mother had PH and had the treatments that you described earlier. She handled it very well, but eventually got pneumonia, and unfortunately, she died 6 weeks later. So she's wondering if this is a hereditary disease. I know we talked about that earlier, but if you could address that again for Bonnie. She says she doesn't have any symptoms, but she wants to make sure she knows what to look out for. So if we can share that information again for Bonnie.
Absolutely. I'm so sorry to hear that, Bonnie. So, there is a subset, a very small subset of pulmonary hypertension, which does run in families or is hereditary, but it's pretty uncommon. Usually if somebody has pulmonary hypertension, it'll be one of the other ones that I was talking about, or it might even be group 1 pulmonary arterial hypertension, but not necessarily something that runs in your family. So that being said, the things to be looking out for would be the heart failure type symptoms, as I was mentioning earlier. So one would be your breathing. Pay attention to it. If there's things that you were able to do 3 months ago, 6 months ago that are now getting you out of breath, that should be worrisome, and that should be something that should at least warrant you being seen by your primary care physician and figure out if it's something that needs to be looked into further. The other thing that goes along with that is fatigue. So if you're getting tired trying to do the things you were doing 3 months, 6 months ago, that's something that should kind of key you in to say, is something else going on? Should we look into this? If it progresses to the point where you've got right heart failure, then you might start seeing, swelling in your belly or swelling in your legs. And those are things that can really, it's never normal to just have swelling in your belly that doesn't go away, or swelling in your legs that doesn't go away. So I think that's one of those things where you really need to look into it and make sure, really look into it. Yeah, the people are calling. But definitely look into it and definitely make sure that you're not missing something more serious like pulmonary hypertension.
Thank you very much, Bonnie. I hope that that helped you to understand what to look out for. And sorry again to hear about your mom. Thank you for watching and for your question. Next one is from Brian. Is there a relationship between pH and diabetes?
So typically, no. Diabetes can definitely lead, if it remains uncontrolled, diabetes can definitely lead to heart disease. And that would be something to kind of keep in check and make sure you stay on top of your diabetes. But typically, there is no direct relationship between diabetes and developing pulmonary hypertension.
Thank you very much. And thanks, Brian, for that question. We have another one from Terry. Do blood pressure readings help to indicate that this problem?
So no, the short answer. So your blood pressure readings are your blood pressures in your body. So they check it on your arm or on your leg, for example. So that's the blood vessels in your body. And if you have high pressures in your body, that's something that needs to be treated. But this is now specifically talking about high blood pressures in the lung arteries themselves. So this is something totally separate, where you say there's something causing the pressure here in the lung arteries to be high. Measuring the pressure in your arm, it may be high, it may be low, it may be totally normal, and it can be completely unrelated, and typically is completely unrelated to what's going on in your lung arteries.
Okay, thank you. Another question from Diane. Do we still use nitrous to treat lung issues?
So I'm wondering if she's referring to inhaled nitric oxide. which is something that we can use as a dilator in the lungs. And it's typically not something people do at home. This is something for people who are sick enough to be in the hospital, and they might even be on a ventilator. And sometimes we can use inhaled nitric oxide to help dilate, because the medicine actually goes directly into their lungs and in their lung arteries, and can help dilate those vessels and drop that pressure in the lung arteries.
Okay, thank you. Are there any specific lifestyle changes that someone would need to make if they have pulmonary hypertension, like their diet, exercise, stopping to smoke, for example?
Yeah, I think any self-respecting doctor is going to tell you stop smoking, but this is specifically something affecting your lungs. So absolutely, stopping smoking is huge. In terms of diet, so typically we tell pulmonary hypertension patients the same thing we tell our heart failure patients. So you need to watch your sodium, your salt intake, no more than 2 grams of sodium in a day. And we watch your fluid intake, no more than 2 liters or 64 ounces of fluid in a day. The reason being, if you put salt into your body or if you put fluid into your body, then it tends to stay there, and your heart then has to work harder to push the blood around your body, and it has more work to do. So if you limit the amount of fluid and salt going into your body, then that's less work for your heart to do. In terms of exercise, typically we tell people to stay active and do all the things, to try to have some cardiac activity 5 days a week, 30 minutes a day, ideally. Same recommendation for any other patients. But there's something specific called pulmonary rehab that we get a lot of our pulmonary hypertension patients into, or any other lung disease patients into, which is typically a session about an hour, hour and a half a day, 3 days a week. And patients will go there where they'll be monitored, and they'll actually watch their blood pressures, their oxygen counts, and then get them exercising and building up that exercise stamina, so they're able to do the things that they would like to do.
Thank you very much. I have 2 more questions for you before we wrap up our broadcast.
Absolutely.
Is there a way to reduce the risk of developing pulmonary hypertension?
Yeah, so when we talk about the types of pulmonary hypertension that are caused by something else, meaning heart disease or lung disease, the way to reduce the risk is to control those things. So, if somebody has sleep apnea, they should be wearing their CPAP every night. If somebody has COPD, they should be using their inhalers like they're supposed to. If somebody has left-sided heart failure, then they should be, on the medications to keep their blood pressures down and keep their heart failure in check. So these are all things that are going to help stop somebody from developing pulmonary hypertension caused by that. So that being said, if you have pulmonary arterial hypertension or group 1 pulmonary hypertension, there's really nothing specific to do to not develop it, unfortunately, because these are things that they just happen. It's a process that happens in your lung arteries. But should you develop it, then staying on top of it and making sure that you're actually, taking the medications the way that you're supposed to, and exercising the way you're supposed to, et cetera, those are things that can really help, keep somebody from progressing with pulmonary hypertension.
Thank you very much. Is there a way to reverse or slow down or even cure pulmonary hypertension?
Yeah, and that's really it. So with pulmonary hypertension, the main thing we're trying to do is we're trying to treat it before we get to the point that the right side of the heart gets so weak that it fails. So as we treat pulmonary hypertension, the right side of the heart can get stronger and can even unstretch back to a normal size if we treat it properly. But if we get to a point where, in spite of all the medicines we're doing and using those 3 categories, as I was mentioning earlier, if in spite of that, your heart continues to stretch and get weaker, you can develop right-sided heart failure to the point that, we call end stage heart failure or end stage pulmonary hypertension. So those are patients, if it's appropriate, we talk about even evaluating for a lung transplant, for example, or if it's somebody who, is not really doing the things they're supposed to be doing, then unfortunately you get to that point, and that's something that that has a very high mortality, and people definitely die from.
Mhm. Thank you very much. I have some more questions from our viewers for you. We have another question from Kyle. Kyle, thanks for your question. Are there any case reports that show whether or not this is more common in one gender over another?
Yeah, so it's not really case reports. There's actually registries that have been done, more so European registries, but they have seen that it is more common in females. So that's something, and depending on which registries you look at, there's a higher, either twofold or fivefold higher chance in females, but everybody agrees that it tends to be more common in females.
Okay, thank you, and thank you, Kyle. This one's from Michelle. She asked, would your pulse ox be low if you have pulmonary hypertension?
Yeah, so your pulse ox or your pulse oximeter is what we were talking about earlier, is what actually measures your oxygen levels in your blood. So if your pulmonary hypertension is to the point that it is causing low oxygen levels, that pulse oximeter will show low, low being less than 88%. But we typically, as I was mentioning earlier, like to keep it around 90 or 92%, specifically in these pulmonary hypertension patients, so that they don't spiral into having higher pressures by having low oxygen levels. So when pulmonary hypertension is first diagnosed, a patient may or may not have low oxygen levels, but they typically tend to develop that and typically end up needing oxygen therapy, wearing oxygen, either when they exert themselves or when they sleep, or sometimes all day, in order to keep their oxygen levels where they need to, in order for their heart to get blood around their body and oxygen to all your organs like you need to.
Okay, thank you. Thanks, Michelle, for that question. Another question from Erica. Thank you, Erica. In addition to blood pressure medicine, should someone with pulmonary hypertension be regularly using inhalers or bronchodilators to help lungs function better?
So it depends on what's causing their pulmonary hypertension. If somebody has a medical condition where they've been prescribed the bronchodilators, so COPD or asthma, then those medications are absolutely appropriate in order to help the lungs work properly, which can then help the pressures in the lungs come down. If somebody has no lung disease, no lung condition, then there's no utility, there's no use of any bronchodilators or any inhalers, because they don't work on the blood pressures in those lung arteries. There is one medication I was kind of alluding to earlier that we use, which is called Tyvaso, and that's actually an inhaled medicine that goes directly into the lung arteries and dilates them. So this is different from regular inhalers that we talk about, like somebody having their albuterol inhaler. This is a specific pulmonary hypertension medication that happens to be inhaled. So you can breathe it in and it can dilate those blood vessels.
Thank you. Speaking of treatment, we have a question from Dana. She says, my son had pulmonary hypertension in utero and up until 4 years of age and is continuously followed yearly. She's wondering if these two treatments are still something that are used. She says, let's see, sildenafil and Lasix. Are those still treatments for pulmonary hypertension?
Yeah, so sildenafil is the generic name for Viagra, as I was talking about earlier. So that's definitely one of the three categories. It's in one of the three categories for pulmonary hypertension treatment. And then Lasix or furosemide is actually a water pill. So we use that in pulmonary hypertension patients to keep the extra fluid out. As I was mentioning earlier, we watch what fluid goes in, and sometimes we may even need water pills like Lasix to help patients pee out that extra fluid. So it's definitely something that we use. Both of them are medications we use often.
Thank you very much. what is a water pill?
Yeah, I mean, I think
My
that's kind
question.
of yeah. So I say water pill. It's called it, because it makes sense to certain people. They drink water and then it makes them pee out the water. What I'm referring to is a diuretic. So
gotcha.
really, if any medication that makes you pee, yeah. So either a diuretic or a water pill, and there's several out there. But we use, furosemide. We can use Bumex or bumetanide. Sometimes we use torsemide as well. They all work on your kidneys to help you pee out extra fluid.
Gotcha. Thank you for that.
Yeah.
Thank you to all of our viewers who have asked questions, especially our viewers who've been watching the entire broadcast and have had multiple questions. We hope that this has really helped you to understand and learn more about pulmonary hypertension. Before we conclude our broadcast, Dr. Krishnan, what is the key takeaway you'd like our viewers to walk away with today after watching this broadcast?
Yeah, so I guess the main thing to say is, pulmonary hypertension, it's rare, but it is a very serious condition. So it's something where if you suspect that you might be having any of the symptoms I was talking about earlier, we don't delay any care. You should really be seen as soon as possible. The reason being, we can start treating it. We do the testing, figure out what's causing it, figure out if you truly have it, and then start treatment as soon as possible in order to kind of prevent or undo that extra stress on the right side of your heart. So it's very, very important to look into it if this is even a potential thing that you think you might have or that runs in your family, et cetera, and not delay medical care.
Thank you. That is great advice. Dr. Krishnan, thanks again for your time and for joining us today, educating our viewers. Thanks to everyone who watched today. For more information or to schedule an appointment, you can call 410-554-6550. We'll post that number in the comments as well. And we hope you all have a wonderful rest of the day, that you learned something new today about pulmonary hypertension, and that you all stay safe and well. Dr. Krishnan, thanks again.
Of course. Thank you so much for having me.
Of course. Bye, everybody. We'll see you next time.
Bye-bye.